Greetings everyone and welcome to today's session of your gastrointestinal system course. I'm Dr. Sally and today I'm going to be taking you through the anatomy of the spleen. And so for this session, what we're going to look at is the location of the spleen. We're going to find out where it's found in the body exactly. We're going to look at the different parts of the spleen. And we're going to just go through the important relations, and we're just going to look at the blood supply and venous return really quickly. This is a relatively short and easy topic, so we should just breeze right through it. Okay, so let's go ahead and get started. One of my favorite online comics is the awkwardyeti.com. He kind of does this fun like fun drawings with like different organs and different parts of the body. So hopefully from this one you can kind of guess what the spleen does. It's actually destroying a red blood cell that has completed its life cycle. So check them out, they're really fun and they kind of make things easy. So the spleen is generally a fist-sized organ, so if you just kind of make a fist, that's the rough size of your spleen. And it is located in the left hypochondrium. It's considered part of the immune system, so the only reason we take it as part of the GIT is that it's just in proximity. It's in the area of the abdomen, so we just kind of take it as an organ in this region, but functionally it's actually a part of the immune system. What it does is that it stores white blood cells and platelets, and like we saw in the comic, it recycles the red blood cells, so if they've completed their 120-day cycle, the spleen just kind of destroys them, and then they can be regenerated from other places. Okay, so this is what the spleen looks like. We're actually looking at it from two sides here, okay? And the structure of the spleen is that it has two surfaces, okay? One of them, which is usually found on the medial side, so on the inner side of the body, okay, and that is called the visceral surface. And you can see here that there are all of these like irregularities and depressions, and we've got blood vessels coming in here and stuff. Okay, so the irregular surface, or the irregular part of the spleen, is called the visceral surface because this is where it comes in contact with all the other organs. Okay, and then the other surface is called the diaphragmatic surface, and this is just like a smooth, regular surface. There's no, depressions or bumps or anything happening here. And this is the surface of the spleen that's usually covered by the diaphragm. Okay, and another thing I want to point out on the medial side here is the region of the spleen where the blood vessel comes in and the vein kind of comes out and the artery goes in. So we've kind of seen this concept in other organs. So this is going to be called the hilum of the spleen. Furthermore, the spleen has borders, okay, and obviously the borders are going to be named according to what side of the body they're found in. So we're going to have what we call an anterior border. And the way that you differentiate the anterior border is you can see here, if you look at the rest of the borders of the spleen, which we'll name in a minute, okay, you notice that the anterior border actually has kind of like a notch and irregularity here, okay? So that's how you differentiate the anterior border of the spleen, by the notch and this irregularity here. Okay, the other borders of the spleen are the inferior border, so that's usually found lower down. Okay, and then towards the back, you've got something called the posteromedial border. Sorry, I didn't fix that font size. And you've also got a superior border. So remember, the spleen has two surfaces, which are the diaphragmatic and visceral surfaces, and it has four borders, which are the anterior, posteromedial, inferior, and superior borders. Now, we already mentioned how the spleen is located in the left hypochondrium, and we're going to see in a minute how it's kind of like smashed or kind of found in between a lot of other organs and other structures. So the spleen is stabilized or kind of held in place with other organs, so it has peritoneal connections with other organs. Okay, and then the easy way to remember them is that they're usually named according to the two organs that they're found between. So you're going to have something called the gastrosplenic ligament, and obviously that is going to connect it with the stomach. There's another ligament that's called the lieno-renal ligament, and lieno usually refers to the spleen, okay, and then renal refers to the kidney. So the lieno-renal ligament connects it to the kidney. And then we've got something called the phrenicoelic ligament, okay, and this is actually a communication between the three organs or three structures, which connects the spleen, the diaphragm, and the transverse colon. All right. So those are the three connections that the spleen has. Please make sure that you know them. And like I said, you can kind of guess where they're found or what organs they connect just by the name of the ligament. Okay? Now, this is the position of the spleen in the body. And like I said, it's found in the left hypochondrium. So looking at this picture, okay, you can kind of sort of figure out which organs the spleen is related to. All right? So, I mean, if you look up here, for example, this is the diaphragm. So you can see how the diaphragm kind of passes down the side here. And then obviously on the outside there, that's going to be the diaphragmatic surface of the spleen because it's resting on the diaphragm. You can see the hilum of the spleen here medially with the vessels kind of coming in. Back here, you've got the kidney. All right, it's been removed, but anteriorly here, we've got the stomach. You can also see the pancreas, specifically the tail of the pancreas, and you can also see the transverse colon or the splenic flexure, and then you can even see part of the phrenicoelic ligament here connecting the transverse colon with the diaphragm and the spleen. Okay, so like I said, as long as you know where the spleen is found, you can kind of figure out which organs, which organs it's related to. So posteriorly, the spleen is related to the left part of the diaphragm or the left half of the diaphragm. And the diaphragm separates it from the pleura and the left lung in the thorax. And then it's also separated from the 9th, 10th, and 11th ribs. Okay, so this is an area that can come up in the exam or in terms of like an exam question. We can sometimes ask you to specify which ribs the spleen is related to, because obviously if someone gets into an accident or any sort of trauma happens to those ribs and they get fractured, then one of the organs that's in jeopardy is obviously going to be the spleen. So remember 9th, 10th, and 11th ribs. Okay? Anteriorly, the spleen is related to the stomach, so in front of the spleen we're going to have the stomach, and then just underneath it we're going to have the splenic flexure of the colon. To the medial side, you're going to find the left kidney. And like I showed you in the picture, you've got the tail of the pancreas resting against the hilum of the spleen. Okay? And then the last thing I just want to look at real quickly is the blood supply and venous return of the spleen. Okay, now if you guys remember, this was, okay, if you guys guessed celiac trunk, you're right. Okay, and you can see how it's dividing into its three branches that end up supplying the foregut. Okay, and so one of the main branches that comes out of the celiac trunk is this artery right here that's kind of running along the upper border of the pancreas, and then you can see how it splits into arteries that end up passing into the hilum of the spleen. Sorry. So this artery here, this is the splenic artery, all right, which is responsible for the blood supply of the spleen in addition to some other organs. All right, and then you can see that along with the spleen and the splenic artery in the opposite direction, you've got the splenic vein. This is going to pretty much just pass along the pancreas as well. Okay, so blood supply to the spleen is going to be by the splenic artery, and venous drainage is going to be by the splenic vein, so that's relatively easy. That's one of the easy organs to remember. Okay, so the splenic artery branches from the celiac trunk in order to supply the spleen. And just before it enters the hilum of the spleen, it divides into 5 separate branches, and then each branch ends up supplying a segment of the organ. So basically, each of the 5 subdivisions or sub arteries is going to end up supplying part of the spleen. And something to keep in mind here is that these 5 branches do not anastomose with each other, so they don't actually communicate. So basically, as soon as one branch comes out, it's going to end up supplying its part of the spleen, and it does not overlap with another part. So that means that the spleen is actually divided into vascular segments, each one having its own blood supply. And like I said, in terms of venous return, the splenic vein is responsible for the venous drainage of the spleen. And the splenic vein is actually really important. We're going to get into more details about it when we take the blood supply of the GIT. Okay? So, I have no idea what happened there. I'm just going to ignore that slide. And that is all I have for you guys today. I hope that session was useful for you. And as always, I'm available for any questions if you need them, and if you have any, sorry, and I'll see you guys next time.